Aloha. Thank you so much for joining us today for the webinar, Managing Mental Health During COVID. My name is Dr. Kathleen Kozak, and I'm here to facilitate today's conversation. This Hawaii Pacific Health webinar event is focused on providing helpful information to the community regarding the increase of mental health conditions during the pandemic, activities that can help us to manage emotional well-being for keiki, adults, and kapuna, and reinforcing positive mental health habits during this time. Before we get started, a few reminders for our viewers. Today's webinar will be recorded. A recording will be sent to all registered participants after the event and will also be available on social media. For those joining us live, please feel free to submit questions using the Q&A button at the bottom of your screen. We will do our best to answer as many of those questions as we can during that portion of the event. We're very lucky to have experts, several of them joining us for today's session. Dr. Shaylin Chalk is a psychiatrist who specializes in child and adolescent, adult, and forensic psychiatry. She completed her training at UCLA and at the University of Southern California and currently works at the Kapi'olani Medical Center for Women and Children. Dr. Bart Pillen is a clinical psychologist who has worked with children and families in community mental health and medical settings throughout his career. He most recently serves as the section chief at the Kapi'olani Behavioral Health Service, a program of Kapi'olani Women's Medical Center for Women and Children. Dr. Bill Tsushima has been a clinical psychologist at Straub Medical Center since 1969. He has specialty interests in clinical neuropsychology and forensic psychology. So thank you all for joining us today on this webinar. Now, I want to jump right in because there's a lot of great information we want to share with you today. Starting off with maybe Dr. Pillen and maybe then Dr. Chalk, what populations have you seen that have had the greatest impact from the COVID-19 pandemic?
Well, I think with the pandemic affecting over 20,000 people here in Hawaii, it's affected each and every one of us, quite frankly. But there are areas of our population where it's really affected us much, much more, including, people who've been affected directly by the illness or maybe even loss, economic problems, of course. But we also know that certain groups of people, like essential workers, for example, who've been exposed and working throughout this whole pandemic for many months, have really had a lot of extra stress and exposure. So those are some of the populations. In short, I think that this whole situation with the chronic stress has magnified the good and the difficulties that people experience.
Shayla?
Dr. Chalk, what have you seen in your practice?
Sure. So I primarily see children and adolescents in our practice here. And we do know that our kids have been struggling with anxiety and sometimes some depression. So those are the two kind of largest problems that we've been seeing with regards to the pandemic. But you have to realize that not everybody has a clinical diagnosis of depression or anxiety. I think everybody is sort of struggling with symptoms of both, and they kind of flip-flop, and at times they may feel more anxious, at times they may feel sad or isolated. So it's as Dr. Pillen had said, I think everyone is affected by this pandemic, but those are the two most important things that we've been seeing.
And Dr. Tsushima, what mental health problems have increased in your practice in the past year?
I think that this COVID-19 is causing a lot of duress for people. And what happens when they lose their jobs or when they're fearful of getting an illness is they become more anxious, they're fearful. Some become moody and depressed. Looking at previous pandemics or outbreaks, similar reactions took place. Financial problems, economic downsides, and shutdowns, lockdowns, all those things have caused in the past feelings of fear of the future, of the uncertainties. And we're just seeing a similar version nowadays. I don't think it's that much different than what I've read about previous problems.
Dr. Pillen, do you think, are there other factors, other issues that might be going on in people's lives that make some folks a little more susceptible to experiencing some of the additional stress related to coronavirus?
Absolutely. To build on what Dr. Tsushima was just mentioning, if you've had struggles and these worries that have, you've encountered during this pandemic, there's the acute issues, like if you suddenly lost your job or suddenly somebody in your family was impacted by the illness, you're likely to have anxiety, almost like PTSD. We know that medical trauma, personal trauma can really expand. So when people go through a car accident, they might have PTSD. Same thing that's happened here. But the other longer term factor, of course, is the chronic nature of this, this whole situation. It's worked on us in so many ways over many, many months. So it kind of conditions us to have more problems. So if you're more isolated and you don't have social support, I know social distancing can be difficult, right? Okay. But if you have not meaningful assistance in your home or even over the telephone or video, that can affect us. If you have health issues that were pre-existing, of course, that's an extra burden and it just gets magnified. And financial and occupational concerns, of course, have affected us all. So those contributing factors are the things that tend to tip us towards the emotional and mood concerns that Dr. Tsushima was talking about.
Dr. Chalk, when you mentioned earlier about children experiencing symptoms of anxiety, how do kids and adolescents express that? I think, for adults, sometimes because we may know what makes us anxious and we may know and see that in other people, it might be a little bit easier to detect. Is it harder to figure out when a child is expressing those or experiencing those symptoms and how they might express it in their activities or just the things that they do?
Sure, you might notice that for younger kids and teenagers, they might be a little bit more irritable. So the littlest things sort of might set them off that maybe didn't set them off before. You also might notice that they're a little bit more withdrawn. So maybe you had a child who used to really enjoy playing with certain things and kind of interacting in one way, and you might notice a change in that. And then when you're looking at the teenagers, you might notice that we're used to our teenagers kind of huddling up in their room on their devices and that sort of thing. But you might notice that there might be a change in sort of what that looks like. So they might not be as interested in interacting with peers or friends, and they might instead be sort of just kind of scrolling social media kind of quietly. I think the best way, though, to figure out if your child is struggling is to just ask. I think that that's something that we all kind of take for granted, and having a time where you can actually check in with them and say, how are things going? I think that that's one of the best ways for you as a parent to recognize if your child is struggling.
Let me add one note regarding this reactions of younger people. I was surprised when I read a Duke University study on loneliness. And what the study revealed was that children and adolescents report more loneliness than the elderly, when sometimes common sense might tell you just the opposite. But because I guess they are not attending school and can't socialize like before, they're feeling more lonely than older people.
That has been the case that we've definitely noticed. Little kids are used to being on the playground with their peers. They're used to being in school, and they're used to sort of interacting with teachers and friends. And with them sort of being home with possibly siblings, or maybe just not, maybe they're an only child, they're home with their parents or some type of caregiver. And then for our teenagers, that's the time where, as a teen, you're supposed to explore your world. You're supposed to figure out who you are. You're supposed to find how you fit in this world and this society. Who do I want to be? And that has been very difficult given sort of the social distancing and the decrease in structure and activities that our kids are used to.
Do you think that the loss of things like group sports and, you mentioned the virtual learning environment, do you think that has really had some negative impacts on how kids have the opportunities to interact with one another? Maybe they're reaching more towards social media? Is that something that you think impacts some of the kids that used to be outdoors and participate in a lot of sports?
I do think that that definitely has a negative consequence, especially for our kids who are used to being active and outside. Has been sort of taken away from them. So I think in those cases, if parents can figure out a way to get them back outside, and yes, they're not playing their usual, they're not at soccer practice, but what can they do to sort of fulfill those things that they used to do with regards to being physically active? And then if you're sort of thinking about, that they're sort of more withdrawn or looking more to social media, having parents be kind of creative. I know for little ones, having parents come up with sort of virtual play dates where maybe they have a few families that they could get together. They could all kind of take turns doing activities where the kids are on screens. And these days, there's so many things that you can do virtually. They can do FaceTime sleepovers. Kids have been doing Netflix parties where they all kind of watch a movie together. But we're still missing that human interaction and that face-to-face, the touch and the being together in one space. But given what we're facing and what we're dealing with, I think keeping our families safe from this coronavirus and still trying to be creative in kind of the things that we're doing, I think that's the best thing that we can do for our kids.
Just to add a quick message on that is that there's no parenting manual for how to do this during a pandemic, right? And so my colleague is very creative with the suggestions, and for parents, they many times back away rather than getting that creative and engaged with their children. So this is a time to really lean in on those relationships and not only guide your children, but kind of give yourself some support as parents, right?
Well, I think that's one of the key aspects is, a lot of times we talk about how things are going for the kids. And in fact, the parents often have the weight of the world on their shoulders, not just dealing with trying to take care of their kids, but also trying to deal with the financial stress and the work stress, and then work from home, but try and manage virtual school and all these different types of areas that the family dynamics get really, really complicated. And I know that that's a huge difficulty. Now, there are some things we're going to talk about in a little bit of some tips and tricks on how people can work on increasing their resiliency. And I want to make sure that we have some time to talk about that. Are there any things that you think kids can do to find ways? You mentioned some virtual Netflix parties or things that might interact the kids with people of different ages, and that whole idea of physical distance, but not necessarily the social aspect of things. Do you think that kids are affected by a lot of what they might see on the news? I mean, every time you turn on the TV, there's some other sort of story about what's going on across the world. And I often wonder if kids are isolated, or some of the teenagers kind of have the ability to access things on the internet. Could they be affected by what they read? And do parents really need to take some time to explain the reality of what's going on and help deal with some of those fears?
It's actually interesting that you bring that up, because I think you brought up specifically teenagers, and I want to address teenagers and also sort of the younger Keiki. Parents, and I think adults in general, tend to have the news on, possibly the news on in your house, and the TV is just going and it's talking about the numbers that, what we're seeing. We're hearing about deaths, we're hearing about increases in cases. And you might be driving in your car and the radio host is, every day, sort of at the same time or multiple times throughout the day, they're kind of talking about all of this. For little kids, they don't really understand it all, and they don't take things with the right context. And they might not be kids who will ask you, Mom, what is that about? Or Dad, what is that about? And what happens then is they hear this information and they sort of make up stuff to fill in the blanks for themselves. And that can then cause them to feel scared or anxious or worried. So I think limiting the amount of media that you're exposing your children to would be definitely helpful. And you as a parent want to make sure that you're informed, but at the same time being very intentional and direct in where you're getting your information from and when you're getting your information. And then if we're shifting and looking at teenagers, you're right. Teens are scrolling and looking and reading. Might you take some time at the end of the day or every few days to say, hey, what do you think's going on? Tell me about some of the things that you're reading. Do you have any questions? Are you worried about these types of things? I think just sort of putting it out there and recognizing that your child is intelligent and smart and is taking in information, but might have some questions that you may be able to answer. And if you're not able to answer, kind of showing them that, I don't know. I'm not sure how this is going to play out. I don't know, but we'll figure this out together. And then kind of reminding them what they're doing to stay safe and what you're doing as a family to make sure that you're protecting your family as a whole. I think that's, what I would recommend or suggest.
Comment
Lot of
about
time. Go ahead.
the comment about the media applies, of course, a lot to adults. Some who spend too much time watching and trying to keep up with the latest in terms of who died and and the percentages, and they talk about it. And I think the talk between parents are heard by the children, and that raises their anxiety. So one idea, of course, among adults is to avoid social media because a lot of the internet has very informal and probably inaccurate information, and some adults can't decipher the difference between a reliable piece of information and not. And so our responsibility as adults is to look for more dependable source of information, scientific information or government information. That would be better than just looking at everyday news.
All right, so I shouldn't just scroll down and obsess about the news every night. Point well taken, because I tend to be sucked into doing that at night, and I know it doesn't help with a lot of things. Now, I also find that sometimes, if you're with your family all the time, Dr. Pillen, it's very easy to get into arguments. I know I have, maybe a short fuse, or you're really stressed during the day and you come home. How do you manage conflict within your household? You're trying really hard to help your kids not get worried and live in fear and accepting uncertainty in the future. And you're trying not to get sucked into whatever is on, the news or the apps that you use. And I think somebody needs to take my phone away, which would be a great thing. What do you do in your home? How do you manage that conflict between parents, between, people who are living in close quarters? We have these multi-generational families, and what used to be no big deal might be driving people crazy these days.
Absolutely. You don't know exactly when it's going to ambush you, but it's likely to happen. So you might as well plan ahead a little bit, right? I often tell couples or family members who come to see me, the winner of the argument is the one who stops it, right? So have an idea of how you want to interrupt it, right? So because most times whether it's a parent and a child or in a relationship, within the first minute or so, people know, this is not going well, right? But a lot of times we keep on arguing. We want to make a point. We want to, influence or control. At that point where that voice goes off, like, this is the same old problem, separate for a while. Separate. We know that when couples get into an argument, it takes about 15 minutes for their bodies to calm down before their minds can actually think, okay, I'm going to come back to the relationship a better person or with a better idea and not come back to the argument. Same thing with parenting. If you're frustrated with your children and you take a time out, just like the kids might take a time out, you come back with an activity. I was thinking as we were talking about turning off social media, the low-tech interventions like a board game works really nice, right? Simple things, playful activities, re-engaging, kind of starting up again where you kind of left off with the good part of your relationship. So those sorts of interventions are very helpful for managing conflict.
Okay, I wrote that down. The winner of the argument is the one who stops it.
The sooner the better, right?
Take this note, because that's actually one of those little golden nuggets. The winner, the one who stops it. So, sometimes it's really difficult to remain positive. And, Dr. Tsushima, what advice do you have? Because if you're trying to stop an argument, if you start heading down a negative path, if you start kind of feeling upset and this is not the holiday I wanted, this is not the circumstance I wanted, what can you do to remain positive?
Okay, well, I think we may be talking about two different things. One is you're bringing up the effect of the closeness within the families and how that might lead to some issues. And to follow up on Dr. What Pillen said, is that a lot of individuals feel badly when they are at home and they are in separate rooms. And they reflect on themselves, is this good? Is this normal? We're married and we're not even in the same room. I think there should be greater acceptance of the fact that different people do different things. And when they were working, they accepted the separation, but when they're at home, and they feel there's some kind of obligation to be together. And so that what we found out, and I think, unfortunately, we found out through the news that there's an increase of domestic violence and in some cases child abuse because, and I can talk about my own patients that men who do well at work, but when they come home, there's limited patience or tolerance for little kids. And, but now they're at home longer. And so their patience gets worn out and they are angrier and so forth. So I've actually told one parent, play with your kids, but when it comes to discipline, step away because you're not good at it, and let your partner take care of anything that needs to be corrected.
Well, that's some really good advice, is try and find ways to interact with kids and have a little bit of patience. And I know, Dr. Chalk, you've also talked about how it's so difficult for parents to be able to take such, it's difficult to care for kids under normal times. And now we're dealing with the pandemic, so that just adds another level of stress. What do parents need to remember to do for themselves?
Well, I think the big thing is making sure that you're being kind to yourself as a parent. So I'm a parent of 3 little kids, and I'm also a physician. I'm also a wife. I'm also a daughter. I'm a sister. I'm an auntie, and all of these things. And I think that we need to remind ourselves as human beings to be kind to ourselves. Just as, you would look at your kids and you realize, they're struggling, they're having a hard time. Maybe this is kind of a moment where somebody had a tantrum and you're like, okay, well, and you're kind to them, you're forgiving. You need to do that for yourself. You need to realize that as a parent, yes, we have a routine. Realize you might not get to all of those things that you had on your list to do. You might not have that most magical Christmas moment that you had envisioned having. And be kind to yourself. Realize that you are doing the best that you can. You are, at the end of the day, your family is alive and healthy and well, and you should be thankful and grateful for that, and be kind to yourself when things are not perfect. I think that's, especially with social media, we're always kind of seeing all of these other perfect families or perfect situations or perfect pictures, and that's not reality. So be kind, really, really, truly be kind to yourself as a parent and as a human being.
I read one of the questions that was sent in by someone who registered, and the question had to do with burnout. Mm-hmm. And Dr. Chalk just kind of mentioned exactly what needs to be done to avoid burnout. And that is to say, to allow yourself to have a timeout once in a while. Be kind to yourself.
Yeah. And I know that, with the idea of kids, I really liked how Dr. Tsushima said, interact with them, but when you need to step away, step away. I also think kids really thrive on structure, and not being in school and not having that sort of regular school structure or routine is difficult. So as a parent, coming up with a routine for your family, and notice I didn't say schedule, because a schedule adds sometimes extra stress that you do not need right now. So I'm not saying at 8:30 we're going to eat breakfast, at 9 o'clock we're going to do whatever. I'm saying come up with a few things or things that that need to get done, and things and expectations that you have of your family. Put them up for kids so they can see it and they can know what's coming and what's going to happen. But don't stress yourself out and be stuck and motivated by a clock, because maybe you have set some time to do a board game with your kids, and maybe that's going really great and you guys are having a good time. It would really, sorry to say, but it would suck for you to just stop the game and be like, well, now it's 9 o'clock. now we're gonna move to the next activity. So a routine, kids need routine, and that will definitely help, I think, some of these behavioral things that have been coming up with families living so close on each other's back, in each other's face, 24/7.
If I can add to that,
Dr.
just real quick, the bottom line is perfectionism is really not going to help because this is not a perfect situation. Kind of like if you have a false start and there's some sort of conflict or difficulty, coming back at it after you've had a chance to kind of regroup and try something creative will help you get back on track. Yeah.
Dr. Tsushima, I often think people feel as though they are experiencing this and they may be the only one experiencing this. But, earlier you've mentioned that a lot of people are going through these feelings. It's almost become universal.
Now, I can't think of anyone I've ever spoken to, whether it's my patients or friends that I come across, that they like what's happening. I think even those of my patients who have social phobia, even they who don't like to go into crowds, they miss a lot of the activities that was available to them, even if they don't like to socialize that much. So.
Dr. Pillin, what things can we do to be more resilient? What are some quick tips, if there are such things that you can share with us that can help? This is a holiday time, but also just in general, are there things that everybody can do, little activities that can help them through this?
Yeah. And, obviously if there's persistent problems, you might want to reach out and get assistance. We'll maybe touch on that in a little bit. But the most resilient people who handle stress well, it's not their imagination that they're going through difficult times. The most resilient people are actually good problem solvers. They handle the immediate problem, but they always come back to the positive elements of their relationships or their parenting or their personal qualities. People have heard of PTSD, but people who've gone through traumatic events, a fair number of them have post-traumatic growth. And the factors usually are associated with a sense of, I'm effective as a person. As difficult as this moment is, I can always come back to the positive things. An example in marriages is what we call a 1-to-5 ratio, which is for every one difficulty, you need to have 5 positive things happen in order to balance it out. Well, the smartest couples, the smartest families don't wait for the one troublesome thing. They actually act on those positive events. You don't have to be rigid, like Dr. Chalk mentioned. You don't have to be, on a routine that's so unforgiving. But people dip into the well of the better part of their nature, and they practice that. They wake up in the morning and they lead with that, with the intention of creating opportunities for doing positive things that are meaningful for them. And if I can add one more thought by way of image, if we were to take a picture of you and your family this holiday season, and in the middle of the pandemic, and you're not having the same family members there, but you were to take a look at that picture a year from now, what would you want to see about that image? What would you want to say about your family? Yeah, you can complain about how difficult it was and all the rest, but there probably are some qualities about who you are and your family, your cohesiveness, how adaptable you are. That's the stuff that's valuable and actually helps people be resilient. So you, again, don't wait until next year to think about it. Try to make that live for you this holiday season.
That's a really good point, just to have everybody make sure that they consider that there are some ways that we can find the positive in that. And I like the idea that you mentioned, structure, not schedule. That was another thing I jotted down. And the picture, what would you want to look back on and say, this is how we as a family dealt with this pandemic and how we managed to deal with some of the struggles and difficulties collectively. I think it's fairly fascinating, Dr. Tsushima, that you mentioned that even some of your patients with social anxiety don't like this. That really says a lot. If the people who generally are afraid of public are really concerned that they're being isolated, that certainly does lend itself to a degree of severity of what's going on. Now, we did have some great questions that came in from some of the registrants to the seminar, and I thought maybe we could jump into the Q&A portion and go through some of those. And it sort of dovetails exactly into what you were just saying. So if we're looking at some of the ways, the good ways to do your own sort of self-mental health check-in for you and then for your family members, what are some of the things that you might be able to do to just sort of know if you're okay or if you're struggling? How do you know when it's something you can manage and maybe when you need some extra help?
Okay, let me jump.
Dr.
I'll be-
Tsushima?
I think what we want to be noticing is any changes in ourselves, in our moods. Are we more anxious, more fearful? In our behavior, are we more cranky and showing more anger? And sometimes some health issues, like are we sleeping like we used to, or our sleeping is less. So when some of those, and appetite and energy, if some of those changes are noticed, that's when you kind of pay attention to how your mental health is going.
Dr. Chalk, you're a parent, you have 3 little ones. What do you notice for your kids? And what are some of the things that you're looking out for to make sure that they're not having some major issues that might need further attention?
Sure, we have family dinner every night and we sit around the table and we have this thing called question of the day. And so my guys are little. I got a 3-year-old, a newly turned 6-year-old, and an 8-year-old. So usually there's a question that is asked and either I ask it or my husband asks it, or sometimes the kids ask it. And that's kind of one way that I kind of do a check-in with them to sort of see what's going on or what's important to them. And sometimes when the kids ask the questions, it's kind of interesting because it's a question that's important to them. So the 8-year-old, and this was when they weren't back in school, because thankfully my kids are in school. So the 8-year-old said, the question of the day is, when are we gonna go back to school and see our friends? And that's what he was asking. And then, I said, I don't know what the answer is to that. And basically he then his brother asked, well, I'm gonna guess. I'm gonna say it's at this point. So basically I check in and ask them, straight up ask, how are you doing? How are you feeling? That's kind of what our routine is. And then I'm also just kind of watching, just like Dr. Tsushima said, what's their sleep like? What's their eating like? Are they more irritable? Are they fighting with each other more? Are they getting on each other's nerves more? Because a lot of times kids won't be able to say that they're sad. Some will, but some won't. And you'll just notice sort of this kind of short fuse that you'll notice, especially little kids. So those are the things that I'm watching out for, and to sort of make sure that we're not there. We do also we try to plan kind of silly fun activities. They help me plan it, or sometimes I'll plan it, and hopefully that kind of will be able to get us all back on the same page, because mom and dad are both working and stressed out, and the kids are also kind of feeling their own anxiety and worries. So trying to just reconnect in a fun and positive way, that's usually what we try to do.
If I can extend that to adults, the whole notion of checking in is really important for the parents or anybody to do. Don't postpone. Don't wait till the end of the day when you're totally exhausted or even depressed or stressed out. Check in every once in a while. They have mindfulness apps on your phone that kind of signal you to kind of like say, how are you doing physically or emotionally? And if you find that the answer is always negative in tenor, then like Dr. Tsushima says, that might be an indication that you're not able to see those positive things and act on them so well. So reach out for help.
Let me comment on, we just talked about some observable changes. Let me talk about one thing that might be more intangible, and that is a person's feeling of self-worth or self-esteem. With what's going on with COVID is, with the adults, is a loss of income, a loss of your job. And with it goes a loss of identity. And of course, feeling of failure, of not being able to do as well as before. Even with children, we're earlier talking about sports, and I think that everyday sporting teams can give even the average kid a feeling of esteem because they're playing a sport with the other people. But yesterday when I saw some of our standouts signing their agreement to go to different colleges, I really felt sorry for them because this was their year to really shine, their senior year. And what happened? Nothing. We couldn't see them play their best sports, and they probably dreamed about being great in their senior year, but their esteem was affected, I would think, because they didn't have a chance to show their skills.
If any of the kids or adults or adolescents get to the point where they do need some expertise and expert help, what should they do? Who should they reach out to? And how can they start that process of having a mental health professional and expert help them through their struggles?
Well, I think there are some steps we should take before we do that. I think that we ought to reach out, as we ordinarily do, with the social and family supports and our friends, and get some support and some reassurance that things are going to be okay. So there are other ways of getting assistance before we do that. I think that eventually, if you really have a lot of symptoms and feel that you're not functioning, you're so lacking in energy and motivation, I think talking to your primary physician is important. Now that doctor might be just reassuring them that it's okay, it's normal. Or if they sense that it is, that requires a little bit of help, they might provide some minor sedatives or tranquilizers. Or if they think it's really serious, they might refer to a psychiatrist or psychologist for assistance. So these are some of the steps I think would take if there were persistent symptoms and a real change in functioning.
I would really endorse accessing support from a primary care physician or pediatrician, for example, for children. But I think a lot of times people feel like, oh, it's really not that bad. They kind of talk themselves out of seeking advice or even just checking it out. Call your physician. There are also different phone lines, especially if you're worried about depression or even thoughts of harming oneself, or there's flare-ups of anger. It's better to reach out before it's a 9 out of 10, right? We don't want to wait until it's a real crisis. So.
I'm sorry, I'm just noticing there's some questions in the Q&A. So one of the questions was, can you discuss how to manage stress at work? So, I mean, I was just thinking, I guess it depends kind of what that stress meant. I think Dr. Tsushima kind of noted that if the stress at work is that you're not working, that sometimes that loss of identity can be something that could be affecting you. And then as far as how to manage stress at work when you're at work, I think talking to your peers and your colleagues is important, because I think everybody at work is probably just as stressed out as you are. I think that we've, Dr. Pillin and I are on the wellness committee here at Kapilani, and we talked about how can we, help each other kind of make sure that we're all okay. And one of the big suggestions was actually just having peer-to-peer support. So I would say, to manage that stress at work, I would check in with your coworkers and say, hey, I'm super stressed out. Sorry, the light goes off if you don't move around in my office. I'm stressed. This is stressing me out. How are you guys? What are you guys doing? How are you guys managing it? Because you'd be surprised at how much kind of input, what works for somebody, they might suggest it, you might try it, and you might say, hey, that does work. So I do think with regards to managing that at work is just the same thing that we're saying with your families, is just checking in, asking, how are you doing? I'm super stressed out. Help me. What do you think? I think that would be sort of the best way to navigate that.
If I can add to that, pay attention to patterns. There's usually situations both at work and at home that are kind of aggravating, and they keep coming up over and over again. So if there is something specific, you might, like Dr. Chalk said, check in with your colleagues to say, hey, is this my imagination, or can we work together to kind of solve this problem? The other part about distress is there's this echo in our minds. We might have a difficult exchange, and then be thinking about it for the next half an hour or next hour. The longer you think in a negative way, that's practicing depression or anxiety or irritability, right? So again, that check-in and connecting with other people, decompressing physically and emotionally, that can help out as well.
There was also, oh, sorry, go ahead.
Okay, I think I've helped some of my patients having a different view of their work stress. I talk to them about my patients who are unemployed or underemployed because they can't go to work only 3 days a week. But those who are on furlough and they don't know if they're ever going to get back to their jobs. So I point out that aren't they lucky to be working? And when they begin to take that perspective, then the stress at work is still stressful, but it helps them to think that, boy, am I lucky that at least I have a job right now.
Perspective is key, I think. You know, it's how are you looking at the situation and what is your perspective?
Well, and I certainly want to take a moment to give out the crisis line, because I know that there's a lot of things that people can do on their own, and they really should, like you mentioned, Dr. Chalk, check in at work and make sure that you're talking with your colleagues and talk with your family and talk with other people and look around and see what good things you do have. And I certainly don't want to expect that everybody, unfortunately, is going to have that level of resilience. So if there is somebody at crisis, do know that the crisis line of Hawaii is there to help. They're available 24 hours a day, 7 days a week. On Oahu, you can call 832-3100. Neighbor islands can call 1-800-753-6879. And make sure that if people do need help, that they actually do reach out, because there are some great professionals there who have the opportunity and the ability to help you navigate through some of these difficult times. We just have a couple of minutes left. I want to give each of you a chance to share with us some final thoughts on things that all of us can do to keep ourselves mentally and physically well dealing with the pandemic. We'll start with Dr. Pilan.
Well, start with the fundamentals. Try to eat well, sleep well, find opportunities to take care of your physical well-being and decompress before stress mounts. And one of the things that we've touched on lately is find meaningful activities. Crummy things like pandemics happen by accident, really. Nobody plans this. The positive things in your life are intentional, whether it's a board game with your kids or connecting with your partner or your spouse. We do these things on purpose because they have meaning and that lasts. So I would put that on the calendar in some fashion.
Dr. Tsushima?
One of the things I liked about our discussion today was comments made on resilience. And being the oldest member of this group here, I can talk about things of the past that we recognize in our society, how our society has been strong. And of course, we talk about World War II, and they were the best generation because they coped with this tremendous war, both in Europe and in the Orient. But even when I recall during the years that the Korean War was on, that there were some changes in our lives, and I think that the community here, as well as on the mainland, dealt with it well. So that one of the things that we see on TV often is they talking about Hawaii strong, and I like that, because it emphasizes the more positive aspect instead of just talking about the statistics on who died and how many people are sick and how young they were when they died, and I think the thoughts of being strong and being strong like previous generations, I think that's really very, very helpful.
Dr. Chalk?
Sure. So I'm going to speak to the parents, and I'm going to keep it pretty real. So I think it's changing your perspective when you need to. So instead of, I have to stay home with my kids while they do homeschooling, maybe you should say, I get to stay home with my kids. I get to see what their school is like. I get to see them at home and interact and do these things. I get to spend extra time with them playing board games or outside instead of I have to. I think that for me personally, I have to do check-ins at times and reshift my get and have and what, and so just I would say realize that this probably and hopefully isn't forever, and this is a snapshot in time, and try to use the time that you have in positive ways, and realize it's not going to all be positive. Sometimes you're going to struggle, sometimes you're going to feel annoyed and frustrated to no end, but there's a lot of good to come out of this forced closeness and time together, and just finding that.
Mhm.
Well, I want to thank so much to all of our panelists who took the time today to provide such great insights for our viewers and patients watching at home. We do hope you're able to take away some helpful information on addressing some of the behavioral changes that we're all feeling due to COVID, positive mental health habits, and some resources available for patients. As you've heard throughout today's program, Hawaii Pacific Health offers comprehensive services that can support the medical needs of you and your family. From virtual care via video or phone or in-person visits, we are here to keep you healthier. If you have any questions regarding our services or today's webinar, please visit hawaiipacifichealth.org. Thanks for joining us today, and we hope you stay safe and have a healthy, happy holiday season. Thanks so much. Bye-bye.
Thank you.
Bye, happy holidays, everyone.